People always wonder, well, you're getting rid of my veins. What are my legs going to do? You know, so there's two separate systems. There's the deep system, and there's surface system. The deep system carries about 80 to 90% of the blood flow back to the heart.
And that's the veins that are way deep inside of a muscle.
Right.
Veins that you can't see. It's not like the veins that you see on the back of a hand or something like that.
Right.
Okay.
So all the veins we treat are bad veins. They're not doing anything. The blood is sitting there stagnant. So patients always ask me, are you going to help make the flow in that vein better? No, because first you remember that there is no flow in that vein. So that blood's sitting there stagnant, and the only time that blood ever comes out of your leg is at night when you're laying down. Then at that point, you negate gravity, and the blood actually has a chance to move out of your leg. So,
because your heart's really, when you're sleeping, at the same level as your legs, because you're laying in a horizontal position.
Right.
Right.
So that's why one of the distinguishing features of vein disease is that first thing you wake up in the morning, your leg feels great, your leg feels light.
Not necessarily swollen either.
Not necessarily swollen, exactly. And as the day goes on, your legs feel more heavy, more tired, and the pain starts getting worse until...
It's swollen. I mean,
Yeah.
my ankles would swell, all that, on just mainly one side. But I really noticed it when I was riding a recumbent bike, and I'd get shooting pains in my calf and my thigh. I did it before I came tonight. No shooting pains.
There you
Took
go.
care of it.
And you'll find most sources of pain in the human body are when you take one of God's cavities and stretch it. Childbirth,
Right.
for example, kidney stones, cavities, abscesses. They're all when you take one of God's cavities and stretch it, because the stretch receptors translate, when they're stimulated acutely, translate into severe pain. And so in the walls of the vein, there are these stretch receptors. So if you
Right.
fill that vein with fluid all day long and they start distending, those stretch receptors are woken up. And it's an unrelenting pain that sometimes doesn't get better.